Great people. How are you doing today? I'm sure you're fine. You're welcome back to Health Conference YouTube channel. Thanks for tuning in. So today we wanted to talk about something really trending, something scary, of course, Lassa Fever. So we want to know how to prevent Lassa Fever because, of course, that's the best thing to do, prevention. So stay with me. So welcome back. So what really is Lassa fever? The World Health Organization explains Lassa fever as an animal-borne acute viral illness. It is a hemorrhagic fever in that it causes bleeding, and it is caused by the Lassa virus, which is a member of the Arenaviridae family of viruses. Lassa fever is an infectious disease. It is an infectious disease, and it's also known as Lassa hemorrhagic fever. Okay, so what are the symptoms of Lassa fever? What are those indicators of Lassa fever? It is worthy of note that about 80% of people who get infected show little or no symptom at all. Now, for the 20% who are symptomatic, the onset of symptom is gradual, that meaning it progresses from one stage to another. So the first things you see the onset of symptoms take between 6 to 21 days. It comes in not less than 6 days after exposure to the virus and not longer than 21 days. Okay, so the first things you notice are fever beyond 38 degrees Celsius, and generalized weakness of the body and sick feeling. And after a few days, headaches set in, chest pain, sore throat, muscle pain, abdominal pain, diarrhea, cough. And in very severe cases, you notice facial swelling, bleeding from the mouth, nose, and even the vagina. And of course, this bleeding and diarrhea accounts for a reduced blood pressure. Yeah, if tested, there you could notice protein in the urine. It's plus or minus. There may be, there may not be. And also the of course, reduced blood pressure, diarrhea. This also accounts for shock. The person can get into coma at this stage, exhibiting convulsions, seizures, tremors. So you see, if the kidneys, if the kidneys, spleen, and liver are involved, it could really be fatal. Although the risk of death in Lassa fever is just 1%, but especially in pregnant women in their third trimesters, there could be maternal death or miscarriage. But nevertheless, okay, like I said, the risk of death is just 1%. Now, for those who are lucky to survive, they could also go down with complications such as deafness, though partial hearing, partial, not complete hearing, partial hearing returns within 1 to 3 months after recovery from this disease. So the best thing to do is prevention of Lassa fever. We just need to prevent Lassa fever because it could be deadly. In the case of death, this occurs within 14 days after onset of this disease. That's why we say it's acute. It's a short-term disease. It's not a long-term one. It happens, just sets in, does what it has to do, and then leaves. So we need to prevent Lassa fever as much as we can. Now, what is the cause of Lassa fever? It's simple: exposure to the urine and feces of the mastomys rat. Yeah, the mastomys rat is the cause, commonly known as the multi-mammate rat. This rat is endemic in West Africa. So what you need to do, how does it introduce the virus into the system? Through inhalation. If you inhale particles of this urine or feces, you become infected. And then if you're exposed to it, maybe through cuts and sores, open wounds, you could also be infected. Because once a mastomys rat is infected, it does not get sick, yes, but it has the potential to shed this virus through its urine and feces to anyone who comes in contact with it, either directly or indirectly. Now, the risk of transmission is higher in rural areas. Of course, these people, this is where you have the rats more, in rural areas, villages close to bushes, because you have bushes around, so you have the rats more in these areas, and especially in crowded areas, in dirty areas, most of the rural areas, the status of their sanitation is really poor, so you have the mastomys rats thriving better in these areas. And talk about health workers who are exposed to infected patients, they're at a higher risk of contracting this infection. So what is best to do? Proper sanitation and protection, use of personal protective equipment, I mean appropriate personal protective equipment to stay protected from this infection. Okay, now so let's talk about the diagnosis. How do you know there is Lassa fever? Of course, there's no room for self-diagnosis, there's no room for self-treatment, because it could be tricky, it could really be tricky diagnosing Lassa fever, because the symptoms you have in Lassa fever are the same exhibited in malaria and other hemorrhagic fevers, such as other viral hemorrhagic fevers such as Ebola, even typhoid fever, shigellosis, they all share the same symptoms. So trust me, there's no room for self-diagnosis. Whenever you feel any discomfort, visit the hospital for definite diagnosis. You just can't say you have Lassa fever by mere symptoms, the symptoms you notice or the signs you see. But definite diagnosis can only be made through laboratory investigations, with ELISA, antigen detection, virus isolation by cell culture. So just visit the hospital. That's all you need to do. Visit the hospital. Or if you suspect it in a relative or anyone, advise that the person visit a hospital. If advice is not enough, you can also notify your local and national health authorities. Okay, so what are those treatment measures? How do we manage Lassa fever? Yeah, going to the hospital, of course, once you start noticing discomfort, not when it intensifies or when you get to the stage of bleeding. Early detection and intervention is what can prove effective. Now we have an antiviral drug, the ribavirin. Now this drug only works when given early. When given early administration of this antiviral drug is effective. Only early administration, not when you're almost recovering from the disease or you're already in coma. Now, what are those things we can do to improve our chances of survival? Rehydration. Of course, the extent of the damage done is expressed in the symptoms, in the progression of the symptoms. So we have to see how we can treat the symptoms by improving the blood pressure, improving the body functions by rehydration. Constant rehydration can go a long way in improving your chance of survival. Okay, so now this is the most important aspect of this presentation. So how do we prevent Lassa fever? Of course, like I mentioned earlier, the best thing to do is prevention. Generally, we know prevention is easier and cheaper than cure. So how do we prevent Lassa fever? Of course, we can't eliminate the multi-mammate rat completely in areas where it is endemic. But what do we have to do? We just have to keep them away from human habitation, because you shouldn't even get in contact with these rats. You shouldn't even have them around you. So what we need to do is the aim therefore is to prevent them from human habitation. Okay, so how can we do that? Proper sanitation. Keep your environment clean, clear bushes around you, and keep your environment always clean, because these rats, of course, thrive, and all other rodents thrive in dirty environments. Another thing is regular hand washing. You need to wash your hands from time to time, and then for our health workers, of course, hand washing is an integral part of safety precautions. Wash your hands before attending to one patient, after attending to that patient, after having contact with suspected infected cases. Please institute regular hand washing. Another thing is storage of food. Proper storage of food. Store your foodstuffs in rodent tight containers to prevent these rats from invading them. And also dispose your garbages very far from home and properly. Yeah, proper disposal of garbage. And also Of course, we'll always care for our relatives, whether they go down with the worst diseases. Yeah, care for your relatives, but be careful, be cautious to be careful when having contact. Be careful to not have contact with bodily fluids, because it is better one person gets infected and then treated than the whole community becoming infected. So care for your loved ones with care. And also for health workers, when in contact, when close to infected cases, like in within 1 meter, please try to use face shields, try to use your goggles rather, and just to stay protected, keep away from inhaling these substances. And also, if you can afford to have cats as pets, of course cats will always go after rats. This can help keep these rats away. This can help eliminate the rats in our environment. And personal protective equipment, yeah, I've mentioned that earlier. For our dear health workers, please stay protected. Use your gloves, your gowns, just stay protected. And also, whenever you suspect a case of Lassa fever, not even until confirmation, at the stage of suspicion, please notify your local and national health authorities for arrangements for the appropriate investigations and treatment measures. Now, for our travelers, please, we need to keep not only, we don't have to be only careful about those coming in from the West African countries, but every person traveling into the country or even into the states. Suspected cases, of course, should be in quarantine for close observation to prevent the spread of this infection. Yeah, let's just try to do all we need to do to stay protected. Trust me, no fears, no worries. We are here to deal with Lassa fever. Thanks for watching, and stay healthy, stay Lassa fever free. Subscribe to this channel if you have not subscribed. Click on the subscribe button, click on the like button, click on your notification bell to get fresh videos every Friday. Thank you. See you next Friday. Bye.